Good morning, everybody. Thank you very much for joining us for our press briefing on how the state is responding to the pandemic. And today is another one of our press briefings in our Back to School series. We're going to be having Greg Adams, who's the Executive Director for the Community College Association of Nebraska, or Community Colleges of Nebraska Association. Nebraska Community College Association. There we go. I'll get it right eventually. And Jordan Engel, who's the Superintendent of the Grand Island Diocese Schools. We'll be having them come up here in a moment. But as always, we want to start by reminding people, folks, the virus is still in our communities, so we have to continue to practice all of our good social distancing guidelines, which means keep that 6 feet of distance between you and other people when you go out in public, wear a mask when you go to the store, wash your hands often. If you see a crowded bar or restaurant, that's a great opportunity to turn around and go to a different one. At the end of the day, this virus spreads from one person to another person. So the things you can do to mitigate that will help slow the spread of virus. And of course, the whole reason we're doing all of this is to preserve our hospital capacity. This is a virus, we cannot stop it from coming. But what we can do is make sure that anybody who needs that hospital bed, that ICU bed, or that ventilator has access to it when they need it. And we've been very successful in the state in being able to do that. We've always been able to provide that hospital bed, that ICU bed, or that ventilator to anybody who's needed it when they needed it. In fact, if you look at today, our hospital capacity, we have 36% of our hospital beds available, 36% of our ICU beds available, and 80% of our ventilators are available. So those numbers have remained robust through this entire pandemic, and that is our guidepost. That is what we look at. So I know there's been a lot of talk lately about positivity rates, some of the problems with the federal data. We have seen increasing cases, but we have been able to manage this in a way to preserve our hospital capacity for the folks who need it. So please continue to keep that in mind. Also, I want to talk about Test Nebraska. That's another great way for people to sign up and be able to fight back against this virus by getting signed up for Test Nebraska. We have locations around the state to be able to do that. We have locations 6 days a week in Lincoln and Omaha. We are opening up another testing location in Omaha at the Oakview Mall, as well as having the one at Crossroads. So we've got lots of testing opportunities, so please take advantage of that. I do want to remind people, though, that if you are symptomatic, again, part of our directed health measures, if you're symptomatic, you should be staying home so that you don't infect anybody. And even if you go get that test at Test Nebraska, you need to stay home. Okay, so if you're symptomatic and you go get that test and you don't go out and go anywhere, if you get that test result back, it says you're negative, you should still stay home until as long as you've got symptoms, because it's probably something else, could be the regular flu. You don't want to give that to anybody else either. But certainly, if you have symptoms, stay home. Even if you've been tested, you need to stay home until you get those test results back. And certainly, if it comes back positive, follow all of our guidelines with regard to staying home until you're over the coronavirus. So I just want to remind folks about that. That's very important. Also, do want to make people aware of an issue we have with some commercial vendors, specifically Quest Labs, who are providing testing to various outlets like CVS or Walmart or something like that. The time it's been taking Quest to get back their test results is anywhere over the last couple of weeks between 8.37 days and 10.51 days. In fact, we've had some instances where those test results have been even longer. And when I say even longer, 15, 16 days. You can see that if it takes that long to get those results back, it really makes those results kind of useless. So with Test Nebraska, our average over the entire lifetime is about 2.13 days, much faster than what those Quest Commercial Lab is getting back. So we really want to encourage people to use Test Nebraska. Now, we have seen that our test results have been coming back slower as well with the increased volume and so forth. Over the last couple of weeks, we've been about 3.5 days on average to get those results back. It's longer than what we'd like. We're working to expand the capacity in the lab. We're staffing up. We've got a team looking at how we can reduce the time further. So we are looking at ways to be able to reduce that time, but it's still much better than some of those other venues. So if you are interested in getting a test, I'd certainly encourage you to sign up for Test Nebraska. We've got, as soon as you get signed up, you can start looking for a time to get scheduled. And we've got spots available here in Lincoln, Omaha, around the state, working with different healthcare providers. Please consider testnebraska.com to be able to do that. All right, so back to school. First of all, I'd like to bring up Greg Adams, who's Executive Director of the Nebraska Community College Association. And a couple things about our community colleges and all of our institutions of higher education. They all have been working on their plans to bring people back into class this fall. The community colleges, however, have been doing this all summer long, right? They don't have the same type of schedule as maybe some of our universities where they have, kids go almost completely away over the summer. They continue to provide those classes throughout the course. And so they've been working on things such as temperature screening and sanitization and spreading out classrooms and all the sorts of things that everybody else has been working on to be able to make sure we're mitigating that spread of the virus and slowing that down. The community colleges also are, of course, a great partner in our workforce retraining initiative, which is how we're using some of our CARES Act money that we got from the federal government to help somebody whose job or income has been impacted by the pandemic to be able to get retrained, be able to get that certificate. It's something that a program that we're doing through the community colleges. You can find out about it on our Department of Economic website, getnebraskagrowing.nebraska.gov. But the community colleges also have navigators to be able to help people to do it, and the program is being administered through the community colleges. So great opportunity if you want to get that certificate. There's a scholarship out there available for you. Work with the community college to be able to get that set up, and that offer is going to be good through the end of the year. So there is a time limitation on it, but please consider that. Our community colleges do a great job of helping people get trained up to take these jobs and really perform a valuable role in our overall education system. And they, of course, are dealing with the same sorts of pandemic lessons that we're dealing with in every other aspect of education. And so Greg Adams is going to come up and talk a little bit about what the community college has been doing. And like I said, they've been doing it all summer long to be able to manage this virus and still continue to educate students. Greg?
Thank you, Governor, and thank you for the opportunity to talk about our community colleges opening up, and maybe at the end of that talk briefly about the retraining grant. The first thing I would say very simply, within the next 2 weeks, all 6 of our community colleges will be open, and we will be open as close to normal as we can possibly open up. In the last several months, all of our college leadership have been meeting together. They have been meeting with our colleagues in the other higher education institutions here in the state. They've been meeting with local health departments. They've been meeting with the governor's office. And we've been talking to our students through surveying, finding out what their level of precaution is and what their intentions are. And what we know is that we can open up, we can do business, we can do in-person, we can provide a valuable, productive educational environment, and we believe we can do it safely. But I need to throw in one other thing. We also understand that we are going to have to be flexible. If something isn't working, we're going to have to turn on a dime and try something different. And whether it's scheduling or class size or in-person versus remote, we've laid out our options, and we're fully prepared to implement in whatever way that we need to. As far as the opening, some of the things that, and as I describe this to you, realize that I'm talking about all 6 community colleges. It's an overview. I could identify this college that may be doing something slightly different than this one, but generally here's what's going on. Within the next 2 weeks, they'll be open. Masks will be required of faculty, of staff, and of all students on all 6 campuses. Of course, there will be some exceptions, and those will be laid out for students and faculty and staff so that they understand when the masks don't need to be worn. Testing. We'll be working with Test Nebraska on all of our campuses. It will be voluntary, but we will have access to Test Nebraska. We will also have access to healthcare providers within our communities where our campuses are at, where our extended campuses are at. So we've prepared for that. Dormitories. We realize, and we don't have dormitories on all of our colleges, nor do we have dormitories necessarily on every one of our campuses, but we realize that that's an issue. We have reduced capacity in those dormitories. And in some cases, we've looked for places outside of our dormitory environment where we might be able to place students and place them safely. And if necessary, we have found environments where we can quarantine students or faculty and staff if that becomes necessary. We've tried to arrange for all of that. Probably the most important thing is the classroom. What's it going to look like? Well, our number one priority, of course, is to make sure we have a quality educational experience for everybody. And for a community college, our priority are those trade classes, those vocational technical classes. And granted, a bit of that may be in a classroom, but most of it is in a lab environment where it's hands-on. And we want those students to have that experience. So what we are doing across all 6 campuses, we are planning on 100% person-to-person in all of our technical career classes, our vocational type classes. There will be spacing, there will be masks, and as you might imagine, if you're in a diesel mechanics class or a welding class, the environment in and of itself separates students out and isolates them a bit and puts them in the proper garb for that career and provides a little extra protection. But those are the kinds of things we're going to try to do. If we're outside in construction, it doesn't matter. We're going to be masked, we're going to be distancing, but we're moving forward with people having their hands on the tools that they need to learn those careers. In our other class environments, we're still planning for person-to-person wherever it's possible, wherever it makes the most sense. And a lot of it, honestly, will also be hybrid. There will be some in-person and there will be some remote learning as well. And as I said at the very beginning, what we know is that we're going to have to be very flexible. In some cases, we are front-loading the curriculum. That is, the faculties, we're asking them push a little harder in these first few weeks and months just in case things happen and we need to slow down towards the end. There are just all kinds of things we're trying to do to make sure that the educational experience is exactly what the student is anticipating. And students are telling us in their surveys they're okay with the mask, they want to be in school, and they want it to be person-to-person, and that's what we're going to try to do. The retraining grant, we're off and running. Since I was here last to talk about it, all 6 of our colleges are throwing the net out, trying to grab those people that have been unemployed as a result of COVID or are underemployed as a result of COVID, to bring them onto our campus and put them into a short-term program. Now, a short-term program, we're not talking about an associate degree or a diploma. We're talking about an industry-recognized certificate in high-demand careers within the various service areas of our community colleges. And if you look at the lists we've made of all 6 community colleges, the programs are about the same, but there's a little bit of difference. In a Western community college versus a metro, there's going to be some different demand points. We're trying real hard. We're advertising. DED is, NDOL is advertising for us. The state chamber has been a great partner with this, and they're trying to help us advertise to capture these students and bring them in. Another point that the state chamber is doing for us, they're running a survey with all their membership, their employers, and they're saying, what kind of training do you need? One of the things community colleges are good for, it's not just the programs that we may have in a catalog, but those industry-recognized credentials, we can create programs very quickly for students, those short-term programs. And if there's something we're missing, and there's students that want in, and there's employers that want those people, we're going to do what we can. We have between now and the money going out at the end of the year, we're hustling on this. By the way, we've also done something else. We've also provided a lot of wraparound service for these students that decide to come to our campuses. We know many of them are going to be the non-traditional student. They may need coaching, they may need career counseling, they may need help finding a place to live or finding daycare. We have, either within our colleges or from support outside of our colleges, we're prepared to provide some of those wraparound services for our students to help them out as much as we possibly can. One last thing, I'd be remiss. We have, it appears anyway, as we start out, we're going to have all the protective equipment that we need. And I want to thank the governor's office, and all of my presidents said, when you see the governor today, be sure you thank him, because we couldn't have pulled this off without the help of the governor's office and his staff in getting us what we need, the equipment that we need to open these campuses up and get going. And with the passage of LB 1008, There's an additional scholarship now, the Governor's Talent Scholarship for university, state college, as well as community college students for high-demand areas. So even though it's not job retraining or opening, I'm taking this opportunity to do a little PR moment for that scholarship as well. Thank you.
Great, thank you, Greg. And I appreciate the plug for the scholarship program that's a part of the budget. I'm looking forward to being able to see how many students take advantage of that as well. So great opportunity, whether it's the scholarship program, the workforce retraining, or in general, all the great work community colleges do to provide additional education to get people to take that better job. Appreciate all your work. So thanks. Now, we've also been talking about K-12 schools. I've referenced in the past Dr. Grover's plan for the Grand Island schools and how thoughtful that was about how to bring kids back into the classrooms, giving kids opportunities for remote learning, for families who felt more comfortable that way, and all the other steps to do to be able to bring kids back. And again, this is going to require modification of classrooms, spreading people out, making sure there's lots of opportunities for our young folks to be able to wash their hands often and have sanitizers and wear masks and all that sort of thing that will help slow the spread of the virus. Well, we also have our Catholic schools here in the state that provide a very important role with regard to education as well. Lots of young people here in our state go to those Catholic schools, and the Catholic schools are also implementing the same sorts of plans to be able to bring kids back into classrooms, to be able to make sure they continue to push upon that progression academically, but also for the same reasons we want kids back in our public schools, which is it helps with physical activity, it helps with behavioral and mental health, it helps with nutrition. The overall well-being of the child is better when they have that socialization and that opportunity to go to school. Our Catholic schools understand that as well, and they are working on their plans to be able to bring kids back. And so today I've got Jordan Engel, who is the superintendent of the Grand Island Catholic schools, who's going to be talking to us about what they are doing and just in general about how the Catholic schools are thinking about bringing kids back. So Jordan, I'm going to ask you to come up and say a few words about what the Catholic schools got going on.
Thank you.
Okay.
Good morning. As the governor said, my name is Jordan Engel. I serve as the superintendent of schools for the Catholic Diocese of Grand Island. I also have the pleasure of serving as the principal of Central Catholic Schools within the city of Grand Island. I would like to thank the governor for the chance to come speak on behalf of Catholic schools today. Thank you to Greg for all of the great work that our community colleges do with K-12 schools throughout the state. They provide a plethora of opportunities for our students that they otherwise would not be able to take up. I would also like to thank Commissioner Bloomstead and the staff at NDE for all of their tireless efforts in creating guidelines that allow us to reopen schools in a way that is safe and effective for all of Nebraska's students. Today I'm going to discuss how Catholic schools in Nebraska, and specifically within the Diocese of Grand Island, are uniquely positioned to be reopened in a safe and effective way in the light of the COVID-19 pandemic. Over the course of the past few months, our school leaders have had the opportunity to create new and exciting engagements between local health officials, local school districts, and government officials to create plans to reopen our schools in a way that is safe and effective. Similar to Nebraska's public schools, it is important for Nebraska's Catholic schools to have a uniform plan of engaging those local health experts for guidance in reopening. But we must also consider the differences in local risk, school demographics, and other important factors unique to each school. Within the Diocese of Grand Island, we see a lot of diversity within our schools. Our Catholic diocese stretches over 350 miles from Grand Island to Harrison up near the South Dakota and Wyoming borders. We have 13 schools with over 1,000 students. Some of those schools are pre-K-12, some of those schools are 6-8, and some of those schools are even standalone preschools. All of these things bring different considerations when we look at plans for reopening and having students in for in-person classes in a safe and effective way. Given the fact that our schools are so diverse, it is important that we allow for some degree of freedom when planning for the reopening of schools. However, on a diocesan level, we plan to reopen schools with the following enacted. Students will wear masks as much as possible during the school day. This is especially important in communities such as Grand Island, Kearney, and North Platte, where COVID-19 case counts have remained steady. Students in schools will practice social distancing whenever possible. Our classroom layouts will be and have been modified to allow as much space as possible between students during instruction time, passing times, while eating in the cafeteria, and while partaking in school activities. School administration will stay in close contact with local health departments in regard to DHMs and local expectations for public gatherings and events. Nearly all of our schools sit in separate local health districts. I've had a very strong relationship with Teresa Anderson at CDHD. I know that our schools have been in contact with Two Rivers and Loop Basin, just to name a couple of others. But we represent a multitude of different public health districts, and it's important that communication between schools and their respective public health districts remains open and honest. And finally, we will remain open for in-person instruction as long as the local health department deems it safe to do so. As Governor Ricketts mentioned, we wholeheartedly believe that the best education is an education that happens in person in a safe environment. Within our state, Catholic schools act in solidarity with leadership as they consider the needs of the families that go to our schools. However, it is important to stress that our schools largely self-govern under the principle of subsidiarity. Historically, our schools have self-governed with the needs of the families of that individual school in mind. That tradition of agility and adaptability is going to be crucial in these times when flexibility is not only a must, but it may arise at a moment's notice. Going forward, we are committed to consultation with local health departments, officials from local hospitals, and our families to determine the course of action that allows us to fulfill our ultimate goals of educating our students and uniting them with Christ. Through all of this, we are committed to a deep and meaningful Catholic education for our students. And as we fulfill this mission, the safety of our families is paramount to us. Thank you again, Governor Ricketts, for the opportunity to speak today.
Thank you very much, Jordan, and I appreciate what you were talking about with regard to the subsidiary, because really when you're talking about how do you keep that distance, the 6 feet or wearing the mask, that's really almost going to be on a school-by-school, classroom-by-classroom basis, depending on how many kids you have in the classroom, and so that flexibility is going to be important for every one of our schools. So appreciate you being here today to talk about the plans that you have to be able to make sure that our kids are getting a great education and that they're staying healthy at the same time. So with that, I think just see a couple other things. Today is Thursday. I will have the sine die address that I make to the legislature. It's day 60 of the legislature, so I'll be doing that and have a media availability afterwards with regard to legislative issues. And then on Monday, we will have a news conference as well. And with that, Taylor, I think you had one question that was sent in?
Yes, John Walton says, are you concerned about the ability of the Postal Service to adequately deliver mail-in ballots this year, given the fact that many people will likely be voting by mail?
So Don Walton of the Journal-Star asked, am I concerned about the post office ability to deliver mail-in ballots, given that many people are likely to be turning in their ballots mail-in? I certainly can't address other states. I can tell you here in Nebraska, the Secretary of State is working very hard to protect the integrity of our election system. It seemed to go relatively smoothly. I did not hear any problems with the primary. I would expect the general election to look very similar. In fact, probably we have the opportunity for more people to vote in person in the general election than we did in the primary election based upon the spread of virus here in our state. So I don't have any concerns about the post office ability to deliver those mail-in ballots with regard to our elections here in Nebraska.
So I've got two questions.
Sure.
First of which, if the LB 1107, if that passes through the legislature, will you sign it into law?
So I've got a media availability with regard to legislative issues, so I will defer any legislative questions until we do the media availability on the sine die address and talk about legislative issues. So I'll get back to you on that one.
Chancellor Green, President Carter, they stated this morning reaffirming UNL's commitment to the Big Ten. Any comment on that?
So with regard to President Carter and Chancellor Green reaffirming the University of Nebraska's commitment to the Big Ten, I support them 100%. The Big Ten has been great for the University of Nebraska, and obviously there's a lot of considerations that go into this. I know that fans would like to see football games, so would I. The Big Ten has made the decision they're not going to do football games. Maybe that'll change down the road, but I certainly agree with President Carter and Chancellor Green's decision to stay within the Big Ten and keep that commitment. All right, anybody else have any other questions? Seeing none, again, I'll just say thank you, everybody, for all that you're doing to sacrifice to be able to slow the spread of the virus here in our state. It's been successful. We've been able to preserve our hospital capacity. Please continue to do our basic social distancing rules of keeping that 6 feet distance between you and other people, wear a mask when you go to the store, wash your hands often, avoid those crowded bars or restaurants. Those are all opportunities to be able to slow the spread of the virus by following those guidelines. Remember, this virus spreads from one person to another person. If you're close to somebody without that mask on, that's going to give the virus a chance to spread. And with that, thank you all very much. And again, we'll see you here later today when we have immediate availability with regard to the sine die address and the legislature closing its 106th, second session of the 106th legislature. Thanks again, and we'll see you later this afternoon.